Maayong adlaw everyone! Welcome back to my channel. If you are new here to my channel, my name is Cor and I'm your bistec nurse from Southeast England. So in today's vlog, we are back to our regular programming, which is about our nursing career here in the UK. So in today's video, I'm going to tackle to you what are the common nursing procedures that the care home nurses perform. Care home nurses have the same prerequisite skills and qualifications as of those nurses working in a hospital setting. So there are three different roles of home care nurses, and these are adult home care nurse. So this is the type of nursing that caters to adults and elderly. And there is child home care nurse and mental health care home nurses. So currently I'm working for adults and elderly. So now let's jump straight to our topic, and this is what are the common procedures that the nurses perform in a care home setting. So the most common procedure that we perform is venipuncture, or we do blood extractions for our residents. So in our care home, our GP visit or the doctor's visit is every Thursday. So if the GP orders a blood test for a resident, then we are the one responsible in taking that sample and sending them to the surgery. So the second one is we do nebulization, although this is part of medication administration, since we are giving nebulization for those residents who are suffering from COPD. Another one is we provide oxygen therapy. So some of the residents prior to admission to our care home, they are already prescribed with oxygen therapies. So these residents arrive with oxygen concentrator. So we are the one responsible in checking the condition of the machine and making sure that the resident is receiving the appropriate level of oxygenation. Another nursing procedure that we commonly perform is wound management. So we do basic and complex dressings in our care home. So not unless those wounds are not healing despite our interventions. So that's the time that we refer them to the tissue viability nurse for further management. Another procedure that we do is setting up a syringe driver, and of course this is following a prescription from the doctor. So you will encounter this procedure if you are handling end-of-life residents. So this syringe driver contains medications that will help the resident to have a pain-free and comfortable end-of-life process. Care home nurses also do enteral feeding, and this is what I encountered in my previous and current care home. So in my previous care home, I handled a resident that has NGT feeding, and in my current care home, we do PEG feeding. Although I haven't personally handled this PEG feeding because that resident is not under my unit, but we were trained how to do it. So the next procedure that I'm going to talk about is very common in a care home setting, and that is catheterization. Yes, we do urinary catheterization both for male and females. So these residents might have a long-term catheter in place or for temporary purposes only. So if you encounter residents that has urinary retention and the doctor ordered for straight catheterization just to relieve the symptom, that's very common, and I have done this multiple times. So the main challenge of this procedure is there's a lot of residents who have complex conditions that makes it difficult for us to do the catheterization. So sometimes we seek help from the community nurses, or worse, we send the residents to the hospital. So since we have a lot of residents who has catheter in place, of course, we are also trained to do bladder irrigation. So time to time, these residents suffer from blockage in their catheter. So we do flush their catheters with saline solution that are prescribed by the doctors. It is also very common that nurses in the care home do enema because, of course, the elderly are prone to constipation. And sometimes the oral laxatives are not enough to relieve them from severe constipation. So for your information, not all adult care homes are accepting complex cases. So it depends on the level of dependency of that resident and of course the staffing of the care home. So I'm just lucky to encounter residents who have complex conditions. So aside from all the procedures that I have mentioned earlier, we also do suctioning. Yes. So this procedure is commonly done for residents who had tracheostomy and also for residents who are in their end-of-life care. So once they have excessive secretions that are not managed with medications, then that's the time we do the suctioning. As what I had mentioned earlier, we perform suctioning for residents who had tracheostomy procedures. Of course, we also do tracheostomy cares. So I have encountered this in my previous workplace. We have one resident who had a tracheostomy. So that resident has a very high dependency because time to time there's buildup of secretions and we have to do suctioning. And there is also a schedule for tracheostomy care. It means taking out the tube and washing it. And there's also day of replacing the tube. If you know what I mean, tracheostomy care, as we are trained when we were students. So we are down to our last two common procedures that the nurses perform in a care home setting. And that is stoma care. Yes, we do encounter residents that had colostomy. So we do stoma bag change. So I have encountered this procedure when I was working in Northern Ireland. So it was a good experience for me since I've never done that procedure before. So we were trained how to perform stoma care, specifically changing of the stoma bags and how to look for signs of infected stoma. So the last procedure, although it's very rare, is doing a peritoneal dialysis. So we're just lucky that in our care home, we do have a resident that has ongoing peritoneal dialysis, and his dialysis is done 3 times daily, twice during the day and 1 at night. So it is a very good experience for us. So as a verdict, care home nurses are not only doing medications. So that is totally a myth. Please don't get overwhelmed with all the nursing procedures that I have mentioned earlier because you will not be able to perform those without the proper trainings. So here in the UK, even though you have knowledge and experience with all those procedures, you won't be able to perform those tasks not unless you have completed the training and you have done your competency tests. So rule of the thumb here in the UK, do not perform things not unless you are confident and well trained to do it. Okay? Despite having all the knowledge and skills, it takes an empathetic and compassionate person to be able to work as a care home nurse. As what I have read from an article, it says that being a care home nurse, you must also have the ability to think critically, has excellent attention to details, and solve problems. It also requires a time management and organization skills. Lastly, being a care home nurse, you must have a physical stamina and strength, I would agree, to overcome the challenges of the job. So hopefully you have learned something from today's vlog. So if you have any more questions or suggestions, please feel free, comment down below in the comment section, or you can message me directly on my Facebook account, CordApiTV, or on my Instagram account. So once again, thank you very much for watching this video. If you are new here to my channel, guys, what are you waiting for? Please hit the like button and subscribe to my channel. I'll be seeing you soon. Bye-bye!